Today we're talking to Robin Holland, Community Coordinator with NAMI Stark County, and Stark County Sheriff's Deputy and 2022 Deputy of the Year, Jeff McCollister. Today we're going to be discussing the health and wellness of our Stark County community.
I am a deputy SWAT operator.
I'm a mechanic.
I'm a customer service associate.
Hi, I'm Sheriff George Meyer. Here at the Stark County Sheriff's Office, we are family. We support each other, we lean on each other, and we learn from each other each and every day. There are countless ways to serve Stark County within our agency, and one may just be perfect for you.
I am the Information Technology Director.
I am a canine technician.
I'm a maintenance technician.
Learn more on how you can join our team today and be the difference.
Well, welcome to both our guests. Robin, I'm going to start off with you. Tell us a little bit of what this NAMI is. What does NAMI actually stand for?
NAMI actually stands for the National Alliance on Mental Illness. It's a touchy subject.
Sure. And
so I appreciate you asking us to be here today.
Yeah, and I will tell you that more and more, I'm reading more and more in trade journals, local publications, and certainly on social media about the mental health issues that we face in our country. And specifically, I like to focus on what my responsibilities are, and specifically right here in Stark County. So with that, I think it's great that you guys are with us today. And so we want to talk a little bit about how that impacts Stark County. But first, before we get started, Robin, tell us a little bit about you. How did you get into this business? I know a little bit about your history. You used to work at West Care in Massillon.
I did.
A couple years ago, right? And so how did you get into helping with NAMI and crisis intervention?
Well, you know, I've had a career that's absolutely amazing. When I look at my resume, it's like a who's who of jack of all trades. So I went from West Care to minor league baseball, actually. And I did that for my love of baseball and for my own mental health, because mental health and working in it can be sometimes like banging your head on a wall. So then I came back and worked at the American Red Cross as the health and safety director. And that's where I actually started meeting sheriff's deputies, Jeff Begg and Tim, and a few of them, you know. And we just became friends, and through the years we'd contact each other. But after I got downsized out of my job at the Red Cross, I went to the crisis center. And my position there was the team leader at Hunter House. And if you're not familiar what Hunter House is, it gave me my education in mental health. There's 48 apartments. They're all previously homeless. They're all severely mentally ill and substance abusers. So I was there for about 7 years, and then the opportunity came to go to NAMI. And I volunteered with some of my gents and ladies at Hunter House. So they were starting a brand new position of systems navigator. So in 2019, I went there. And what I did was answered all the phone calls and connected people with services. But at NAMI, that's our mission. Not only do we support, but we educate, which is the most important part of learning about mental illness, but we also advocate for those with mental illness and their families.
Well, that's fantastic, Robin. You've had quite a journey to get to where you are today, and we certainly appreciate you being with us this morning to talk about that journey and how it impacts our community. Now, I'm going to switch directions here and go over to Deputy McCollister, and you know, he is I'm proud to say he's our 2022 Deputy of the Year. There's so many great accolades I can speak to about Jeff. But Jeff, tell us a little bit about you, your family, and what's your passion? How did you even decide to become a deputy? And I know a little bit of this history, but let's share it with our viewers today.
I worked for a large home improvement retailer for little over 11 years. I had a brother-in-law that was in law enforcement. he convinced me to do a ride along. I was later in life, I was in my mid-30s. I decided that it's something I wanted to try and pursue. Originally, I just wanted to do it part-time, continue working with my employer at the time, and it just kind of, once I got involved in it, I just decided that that's what I wanted to do. I wanted to make it a career and serve my community.
Well, it sounds like you made a great decision, and we're certainly glad to have you. We're going to talk a little bit about your involvement as it relates to NAMI and certainly crisis intervention, and get a little bit of insight, if you don't mind, from you on what the crisis intervention training means to you. Robin, with your experience primarily in the mental health field, you're a great resource. But what are some of the concerns relevant to what's going on right here in Stark County?
I think one of our biggest concerns is, like at the Sheriff's Department jail, at the Kansas City jails, even in the prisons, you've become the new mental health hospitals.
Yes, I totally agree with you. And I sometimes say that when I'm speaking in the community, that the largest mental health facility in the county is the county jail.
Absolutely.
And so I think that there's a large percentage of folks that come in the jail for whatever reason that are suffering from either mental health or combination mental health and addiction issues.
Absolutely.
And so it's challenging for our staff. And that's why we made the commitment many, many years ago to have crisis intervention training for all of our deputies and for our corrections officers. And now we're doing crisis intervention training for all our communication technicians. So we really believe in the training and the value of the training as it relates to serving our community. And I want to go back to Jeff here. Jeff, I know we spoke before the program today, and you had your CIT, Crisis Intervention Training, in 2008, somewhere around there?
Yes, sir.
And tell me a little bit about that experience.
I was assigned to the jail division, and I worked in the mental health unit. So when the opportunity came up for me to attend CIT training, obviously I wanted to. I felt like it would be a good tool to have the little, since I've already been exposed to it in the jail setting. So with that opportunity, it really put things in perspective for me. I got to ride with a nurse in the CIT training, where we were basically administering medications to some patients that were in some residential facilities, and then I got to meet with a family, and so that class actually kind of opened my eyes quite a bit, and it gave me a whole new perspective on how to deal with people in crisis. So I was very thankful to receive that training.
Well, in fairness to this conversation, I'm going to be completely transparent in that I've been in law enforcement a little over 40 years, and I never had the opportunity until I became sheriff to participate in the crisis intervention training. So sometime in 13 or maybe early 14, I went through the crisis intervention training. And just like Deputy McCollister mentioned, it certainly opens your eyes from a law enforcement officer's perspective of what the connections are to people who are in crisis. And everybody has a connection. Everybody has some type of connection. Not only is that person suffering, there are friends and family members that are suffering along with that person. So I agree with Deputy McCollister that really does give us a different avenue to look at when we're dealing with folks who are struggling in our community. And then fast forward to my responsibilities as sheriff. And I want to talk a little bit about that because Deputy McCollister mentioned while he worked in the jail, he took this training and how beneficial it was to him. And we talked already about the number of people that come into our jail facility who are either have some type of addiction or mostly combination of addiction and mental health issues. And so we have that challenge of dealing with that each and every day. And so the training certainly makes our officers better in their community and what they do, not whether it be in the field or whether it be in the jail. And so I think that's fantastic. You know, Robin, I know we talk about the training a little bit, but to tell our viewers a little bit about how long the training is. I know that we go through this training and we kind of take it for granted that we know, but tell us a little bit about the training.
It is a 1-week training taught through Starkmeyer and CJ at the Sheriff's Department. And it amazes me. It gives them the opportunity to learn de-escalation techniques. It educates them on mental illness isn't something that we can tell somebody, stop doing that. Mm-hmm. You know, it can be a small pinpoint in their brain, but it affects everything that they do. There is just no way for them to shut it off if they get escalated by something. And we talked beforehand. I think one of the big things about mental illness and alcoholism and drug addiction, there's always mental illness there. And that mental illness, they self-medicate with the alcohol and drugs. And somewhere they cross a line that they no longer want to do it, they need to do it. Yeah. So covering the dual diagnosis part. But education is just such a big part of learning what to do in that situation, not yelling at them, not posturing, which, you know, has happened in the past, not so much anymore, which I absolutely adore. But, you know, so many people have been afraid of the sheriff's departments and the police departments. So everyone that's going through CIT, I have seen the difference working at Hunter House that it made in the officers.
Sure.
And that's amazing.
That's great training, and I really enjoyed the training when I went through it, but I want to go back to a couple things that you said. One, you said people who suffer from addiction, they don't want to do it, but they can't stop. And I think that's an important piece for our viewers. And I think we see that, Deputy, in the field.
Yes, sir.
We deal with folks who have these addictions, whether it be alcohol, drugs, whatever it is. And it's hard for people in our community to understand, but it's a reality that it truly is an addiction. While their hearts and their minds, they don't really want to do it, but they can't stop because of the addiction, the drive of the addiction. And certain drugs are even more powerful than others. But the key is here for families in our community who have somebody in their home who may be suffering from an addiction, is there's hope. And there's hope.
There's always hope, even if it's just a little glimmer.
Yeah. And so I know that part of NAMI is to support folks who have addiction and mental health issues. And so that's part of the hope, I think. Don't you?
Oh, I do. I do so much.
Yeah, and so I think that helps us to help our community. And these collaborations that we have are so important. You know, we need to make sure that we continue to foster these collaborations. And we'll talk a little bit more in our second segment about, you know, what those collaborations mean to the community. And so I just wanted to say that it's not easy. It's not an easy job, but serving your community may be one of the most rewarding careers. A career in law enforcement brings new experiences and challenges each and every day. And we're looking for strong leaders to join our team at the Stark County Sheriff's Office. We need deputies, corrections officers, clerks, and more. We train for excellence and we hire for character. And one of our open positions may be perfect for you.
I am a correction officer.
I'm a corrections corporal.
I am the jail commander.
Hi, I'm Lieutenant Jeff Beck. Being a corrections officer isn't easy. The job is tough and it tests you every day. Every officer that works in our jail is making a difference. They are providing an immeasurable service to the community by ensuring the firm, fair, and consistent treatment of our inmates as they navigate the judicial system.
Learn more on how you can join our team today and be the difference.
Welcome back to On Our Watch, and we're talking today about how mental health impacts our community. We got our guest, Robin, and Deputy McCollister, and I want to get back right into our conversation because, you know, we were having such a lively conversation about this topic. And Robin, what are some of the things that we can do or that are being done in the community to reduce that stigma of mental health? You can't tell nobody, you can't ask for help. What's going on? How can we combat that?
Well, I'll tell you what, one of the biggest things about stigma is just getting across to people that getting help for mental illness is just as important as having diabetes or, you know, a heart problem or anything like that. As we age, some of us have problems with our mental health. And it's not per se that it's a mental illness, but the stigma is just getting it out there that it's okay.
Sure.
You know,
it's okay to ask
and that
for
you're not alone.
Right. If you had a medical condition, like cancer or some other medical condition, you'd go to your doctor, right? You'd get some help.
Right, and you might even go to the hospital, and somebody would send you a get well card.
Right.
But if somebody goes to the hospital for mental illness, nobody sends a get well card.
Right. And so we've got to work on breaking that stigma. When I know NAMI does a great job of breaking those things down in families that are dealing with that stigma. And so we have to do that. And I say the same thing about our young people in our community as it relates to school safety. We raise our children and we tell them, don't tattle on your brother and sister. But then when bad things are happening, nobody wants to tell us, right? And so it's the same thing with this. Tell us. We need to hear it. We need to hear it internally. We need to hear it externally. We need to break that stigma.
Well, you know, some of the things that we have at NAMI that help break the stigma is we have a little emergency card that probably all your department has, but it has phone numbers on it for each emergency. But if somebody has no idea where to start, I give them two things. Go to your family doctor, explain how you're feeling, what's going on. And the second thing is call NAMI. You call NAMI and we'll start you off. We'll start you on your journey navigating through the mental health system.
Sure, and that's great advice, Robin. Thank you for that. And I know our deputies have those cards in their briefcases or in their cars so that when they run into a crisis in the field, they're able to share that with our community.
Awesome.
I want to switch back, and by the way, that's great information, and the partnership is what makes it even better, I think. So I want to go back a little bit to Deputy McCollister, and I know he's a little bit modest about this, but not too long ago, Deputy McCollister, following his CIT training, had an incident. He was out on patrol on his normal duties, and he got an interesting call of a trouble call at a local business establishment, and he responded. And Jeff, I know you remember that call like it was yesterday.
Yes, sir.
It stays with you. That's part of the mental health things that we deal with as law enforcement and safety professionals. Some of these things we deal with the rest of our life. And so why don't you walk us through that day?
It was early in the morning. We get a call of a upset customer refusing to leave a local restaurant. I was maybe a mile away from the business. I instantly just started to drive that direction thinking I'm just going to go and tell this person that they have to leave and that the business doesn't want them there. But as soon as I approached the business, there was a large crowd gathered out front, and an individual with a plastic chair, not wearing anything but a pair of shorts, was smashing the window. Meanwhile, the large gathering of people were standing around him with their cell phone cameras and yelling and obscenities at him. So as I began to pull into the parking lot of the business, the individual ran towards my cruiser, and before I had a chance to put my car in park or anything, he was on top of the car. And at that point, I knew my options were limited. As he ran towards my vehicle, I was able to observe an individual, and based on the training that I had received from CIT, I was able to determine rather quickly that he was having some sort of mental health episode. And then I just tried to, once he was on top of my car in close proximity, I just tried to build a rapport with him, try to use the de-escalation techniques that we were taught in CIT, and just try to open a dialogue with him. And I was having some success, and at one moment he was getting down off my car when another individual had come driving by and started yelling obscenities at him again, and then he took off after that individual. We were able to, after a short, we followed, he jumped on that individual's car and was hanging on to the top of that car. And at that point, I'm concerned for both his safety and the person that's driving that car. So we stayed close to that vehicle, and we were able to get that vehicle stopped. And we were able to talk that individual down and take him into custody without any harm to himself or anyone else. Awesome. And I just want to add that he was in a treatment facility and was on a weekend pass and was home visiting family when this occurred. And it's something that will stick with me for the rest of my career. I remember his mom calling me. She called into dispatch and asked to speak to me, and she thanked me for not hurting her son. And that'll always stay with me. I still get a little choked up just talking about that, because that's really what it's all about. So the family, the impact to the family.
And anybody that's a parent, you have the love and care for your child, and you don't want your child to be hurt. And I hear from the community many, many times, and this is why when I first became sheriff a little over 10 years ago, I immediately started developing the partnership and the relationship with NAMI of Stark County, because one of the things that you just heard an example of how the training does so well, and how it helps our officers to deal with and recognize the situation. And I think that in of itself makes the training very, very valuable. Otherwise, that same call could have been tragic. Absolutely. And I talk to people, parents, family members in our community all the time and say, if you guys encounter my autistic child, or my child who has mental health issues or struggling, please don't hurt them. And so we've taken steps. If we have a home where we know we've been there repeatedly because of a situation such as a autistic child, or someone living there that's struggling with mental health issues and going through treatment programs, we know that. Before we get there, we have it in our computer-aided dispatch, that we know that we've been there before, we know what's going on, so that we can notify our officers, handle with care, right? And I know that Deputy McCollister mentioned that he was taken into custody, but I know the second part of the story. And I'll tell you that the person was taken into custody, and they were taken for treatment to a facility where they were got back on their scheduled treatment, and are being very productive, living productively in our community today. And there's the success story of the whole program. And I think that's so very, very important. And hats off to Deputy McCollister, and I think many of our deputies would have done the same thing. I'm not taking anything away from Jeff, but Jeff used those skills, and he actually handled that situation in a textbook performance. And honestly, he was recognized for that. We recognized him locally. He received the State CIT Officer of the Year Award for his actions. But that's what we're trying to get to with the training, with the partnerships, with the collaboration. Absolutely. For all of our officers. I mentioned that recently we've added our communication technicians to the training. We also have added fire and EMS to the training, so that they can take the training. Because quite frankly, your safety forces are out there each and every day dealing with these situations in our community. We are the front line. We are the front line.
Absolutely.
And so we need to have that collaboration. And I know Deputy McCollister, when you're out in the field and you encounter situations like this, you also have other resources. Talk a little bit about mobile crisis.
We use mobile crisis frequently, and it's a great tool. I had the opportunity to work the road prior to having mobile crisis, so we were kind of thankful that it came along. It brings somebody with a little bit more training and experience to the situation. But again, I think of how many situations, we just had one the other day, without mobile crisis, the situation would have been not ended as well as it did.
You know, Robin, I know you're familiar with mobile crisis, and I will tell you, we utilize mobile crisis even in our jail. Even with the crisis.
Oh, absolutely. It's amazing. And the big thing is it's here in Stark County.
It's right here. It's right here. We utilize it. A number of years ago, I was approached by Stark-Mar, and we were asked to do a pilot project with mobile crisis, which we agreed to do. And it was a small team that was put together. Now we have a number of teams that assist law enforcement throughout the Stark County community, okay, in addressing mobile crisis issues where there's something in there that's beyond our expertise as law enforcement officers, our training as law enforcement officers. And so we brought that to the fold, and we have those folks available to us. We're taking that to the next level. We're going to the next level with that, where we're now utilizing a segment of mobile crisis in our dispatch centers. And so I think we've come a long way, wouldn't you agree?
I agree.
We talked about your career and how rewarding your career has been, and I think we've come a long way in just a short period of time on how we deal with those who are in crisis in our community.
We have. I have seen such strides. You know, working at Hunter House, I used to have to call the police department, and they would come in and they would tell people to behave, and you know, that's not going to work. And then by the time they took out, they'd come in, shake the person's hand, look them in the eye, and say, "What can I do to help you?"
Sure.
What a great way to de-escalate someone. It's
Absolutely.
just, how can I help you?
Well, to our guest today, Robin Holland, thank you, and to our deputy, thank you for being here, Jeff, and to our community. This is On Our Watch, and I want to thank you for joining us. If you have any questions or comments about this show or past shows or topics you'd like to see us discuss in the future, please send me an email to onourwatch@gmail.com. I'm your Stark County Sheriff, George Meyer, and this is On Our Watch.